A 65-year-old presents with altered mental status. He has had a nagging cough that has worsened over the past several months. He has smoked a pack of cigarettes for the last 45 years. Labs show low sodium levels and low plasma osmolality. Chest X-ray reveals a mass in the right lung. Which of the following additional findings is most likely present in this patient? Now, this patient's findings are going to be concerning for small cell carcinoma of the lung. And the reason why this is most likely the case is because small cell carcinoma is going to be a neuroendocrine tumor, so it can be associated with paraneoplastic syndromes like SIADH. So we're going to have the cancer cells that can produce antidiuretic hormone, and this excessive antidiuretic hormone can cause low sodium levels as well as low plasma osmolality, and this can contribute to the altered mental status that this patient is having. So this is most likely the cause of his altered mental status is due to the low sodium levels and low plasma osmolality. Now he also has a chest X-ray that has revealed a mass, and he has had a nagging cough that has been worsening, and he also had an extensive smoking history. So these are all going to be signs of small cell carcinoma. Now, small cell lung cancer in this patient's case is producing antidiuretic hormone. And the antidiuretic hormone is going to be putting aquaporins on the apical side of the principal cell in our kidneys. So what this is going to cause is it's going to cause reabsorption of water into the body. So we're going to have an increase in water reabsorption. Now, this increase in water reabsorption is then going to cause a mild increase in extracellular fluid volume. So we're going to be basically increasing the volume in our body because we have this increase in antidiuretic hormone production from the cancer. Now, this is going to result in hyponatremia. As we discussed, it can present with altered mental status, which the patient was presenting with, as well as headaches, weakness, and seizures. Now, when we have an increase in our body's volume, this is going to downregulate the renin-aldosterone axis because we already have more than enough volume in the body. And this is going to increase the natriuretic peptide production in the body. So this is a way in which the body is now trying to get rid of that extra volume that it has. So think of AMP and BMP. Those are all natriuretic peptides that can be released when we have a increase in the volume in the body. Now, when we have those natriuretic peptides released, it is going to cause excretion of sodium in the urine. And so now with this excretion of sodium, we're going to be basically getting rid of that extra volume that we got from this antidiuretic hormone. And as a result, we're going to have a clinically normal extracellular fluid volume. But we still have hyponatremia because remember, in order to get rid of that volume, we're releasing sodium. So we're getting rid of sodium in order to get rid of that extra volume. So we're still going to be in a hyponatremic state, but because we got that extra volume excreted out, we're going to be euvolemic. So there's going to be euvolemic hyponatremia going on. So to answer the question, the answer choice is going to be answer choice B. There's going to be a normal appearing volume status because of the increase in natriuretic peptide release and downregulation of the renin-aldosterone axis. As a result, we're going to have a normal appearing volume status in SIADH. Now, answer choice A, C, and D are all going to be present when there is fluid overload. So think of heart failure in which there is going to be fluid overload in the body, which can result in crackles at the lungs, as well as peripheral edema and elevated jugular venous pressure. So because in SIADH, we're not going to have a fluid overload, we're going to be getting rid of that extra fluid by downregulating the renin-aldosterone axis as well as increasing natriuretic peptide release. We're ultimately going to have a normal appearing volume status.